Gender-Affirming Care. Welcome as well to the second annual Queer Day at the Capitol, which is hosted, this session is hosted by the Hawaii Health and Harm Reduction Center. Overall, the Day at the Capitol is sponsored by the LGBTQ Commission. Yes, woohoo, let's give it up for the Commission. And really grateful that you all came out on in a lot of ways, it's a Monday morning, right? The morning after a holiday, to come and listen from some of the top experts in the state about gender-affirming care. So as many of you know, we have a bill this session and a companion. It's HB 1875 and its companion SB 2868. And this bill would not only provide protections in the state of Hawaii for people accessing gender-affirming care, would also do the same for the providers of gender-affirming care, and also has some protections in it for those around reproductive health care. So we feel strongly that this bill is not just symbolic. This bill will save lives and is essential to helping people access the medical care that, at least here in the United States, we've really feel that that medical care is not only important, but in many ways is a human right. So our panel today is going to start off with Dr. Rick Ramirez. He is a triple board certified practitioner and the medical director of the Gender-Affirming Care Clinic at the Hawaii Health and Harm Reduction Center. We're going to start off with Dr. Ramirez taking us through, well, what is gender-affirming care? Why is it so important that we have this discussion today, as well as get the protections passed, again, with HB 1875 and SB 2868. Then after that, we will have Madeline Sesapasara. Maddie started doing this work in 1998 as part of Utopia Hawaii, went on to work at Kulia Namamo, the state's first and only by and for people of trans experience agency. And now she is the director of Kua'ana, which means big sibling to little sibling project at the Hawaii Health and Harm Reduction Center. She's going to share not only her experience in over 30 years of doing advocacy in our community and the importance of this, but also will bring us home with sharing a bit from her heart. Then we will have Mandy Fernandez, who is from the American Civil Liberties Union of Hawaii. She's the policy director there. And she has been very involved over the years, in addition to being a civil rights lawyer, has been involved in many of our nonprofits on the board and support over the years. And then taking us home should be no other than our Abby Alana Simmons. And she is the chair of the Stonewall Caucus of the Democratic Party of Hawaii. She is a civil rights advocate and will be sharing, both from a policy and personal perspective, why gender-affirming care is so important. So they'll be sharing a bit more about themselves as we go along. We will have time for questions at the end. Also, if you have not gotten, please get the overview from H3RC on the Gender-Affirming Care Shield Bill. But on that, I'd like to welcome Dr. Rick Ramirez up to the stage. So please join me in welcoming him to talk about gender-affirming care, healthcare, not politics. Thank you so much, Dr. Ramirez.
Thanks, Heather. Good morning, everyone. I apologize for the temperature in here. I do not control the temperature in here. I realize it's a little bit cold. But just bear with me for the next 15 minutes as we talk about this very important measure. So if we can go to the next slide, maybe. There we go. I just want to start with a little healthcare allegory. So on the screen here, you see chemo and canal. I just want to implore upon you that the people that you see on the screen are not real. Okay, they're not real. So any names or associations of names or anything that I describe about them are purely not factual. But the story that I'm going to tell you has relevance. So I recognize that people may not totally understand what gender-affirming care is. So I want to choose an allegory to kind of go along with it. So if everyone can imagine kinao or chemo, or maybe a family member that you know or someone that you love, and just imagine, for instance, that they have diabetes. Okay, I'm not comparing those two things together, but let's imagine that they have diabetes and that they need to go and see a healthcare provider. Well, one of the mainstays of diabetes care is getting insulin. Would you all agree that insulin, you've heard of insulin, needing insulin, insulin is a life-saving measure. Did you know that insulin is also a hormone? It's a hormone that is used to put glucose or sugar into the cell of the body so that we can function. Without insulin, we can't make energy. And without energy, we cannot survive. Insulin is evidence-based medicine. It's been around for decades. We use this, and yet there is no question about it. So if we go to the next slide, we can see here that the top factors contributing to death and disease in the United States, and this is from most recent data from 2025, you see that 103,000 people a year die from diabetes alone. Diabetes increases the risk of heart attack, increases the risk for stroke, increases the risk for cancer. And yet we have medicine to help fix these things. We have medicine to help control it. So if we go to the next slide, we can see here that most people don't access healthcare for a variety of reasons. One of the biggest contributors to not accessing healthcare is that people don't have really great or any health insurance at all. Health insurance is a mainstay of health in our community, and way over on the right hand, or on your right hand side, you can see that our transgender population is the most uninsured population in the US. So you can think about, if people don't have health insurance, they're going to be scared or even not being able to access healthcare. So if we can go to the next slide, when people don't access healthcare, when they can't get the healthcare that they need, they're more likely not to obtain healthcare at all. Our transgender folks don't like going to the doctor. They don't like seeking out healthcare services because they have been misgendered, because they have been misidentified. So many, and what's really scary is that a lot of our transgender folks, when they go to the doctor or go into a healthcare setting, they've been victimized, they have been harassed, they have been sexually abused by healthcare providers. That's really scary, right? We have to protect them. We have to protect ourselves, and we have to protect healthcare. And so you can see here, all the way on the right-hand side, our transgender folks have the highest rate of death in the entire United States. Okay, so let's go on. Let's go on to our next slide. So what's really interesting from this, I don't know if many of you have seen this, but this is from data from 2012. It really hasn't changed a whole lot because our demographics haven't changed. But I just want to point out Oahu, that's here in the big green circle. What this is looking at is lifespan here in Hawaii. What's really interesting about this is that if you live in Hawaii, Kai, you get to live to be 83.3 years old. But if you live in Waianae, you only get to live to be 74. That's a difference of 11 years and only 17 miles apart. Look at Kauai. Up on the North Shore, you get to live to be 75, but on the South Shore, you get to live to be 85. It's a small island. Why is that? Look at our state. Look at the population of our state. You can see in Maui County, you get to live to be 83, but on Molokai, you only get to live to be 70. It's in the same county. What is going on? So let's go to the next slide. Here, according to the Williams Institute of 2025, our transgender folks make up approximately 1% of the entire US population. In the state of Hawaii, transgender make up about 0.7% of the population. That's only 8,000 people across the US. And I assure you that number is severely low because a lot of people don't report because of fear, right? So if we can go on to the next slide, when we look at mortality rates of Hawaii compared to the United States, we can see here that in Hawaii, our death rates are higher for our native Hawaiian population. They're along the same lines as African Americans in the United States for our own native Hawaiian population versus any other population in the state. That's really scary, right? So let's go to the next slide. When we look at specifically at gender, the most populous people who have the highest death rates are our native Hawaiian transgender women. They have the highest death rates out of everyone in the entire state. We have to do something to protect them. We have to do something to protect healthcare in this state. We can't allow this to go forward. Let's go on to the next slide. When we look at just our transgender folks and looking at race, we can still see our native Hawaiian transgender women outrank everybody for the highest rate of death in the entire state. Next, after that is our Asian and Pacific transgender women. The highest rates of death in the entire United States. We have to fix this problem. That is what this bill is all about. Let's go to the next slide. Here again, we have evidence that in the entire United States, our transgender folks make up maybe 1% of the entire population. Push the forward button. Yet over 670 anti-transgender bills were introduced in the US in 2025 for less than 1% of the population. What is that? Why? What is going on? Okay, go on to the next slide. I have to take a moment and talk about medical provider disparities. So if we go to the next slide, this is a report that was presented to the Hawaii State Capitol from Kelly Withey and her department over at UH Manoa. Kelly Withey is a medical doctor who does research on all of Hawaii's based medical providers. If we go to the next slide, this is from 2025, and you can see up in the top right-hand corner the shortage of medical doctors in the state currently for 2025. We are 803 doctors short of the entire state. And out of those, for primary care providers, we're 178 doctors short for the entire state. If you go on to the next slide, I pulled this out specifically because it was the most surprising. So this is for Kauai County. This is the amount of medical providers that they need over in the left-hand column. Over in the right-hand column or in the middle column is how many they have. Look how many zeros there are. Kauai County has no medical providers in order to provide medical care to that portion of the state. There are 0 people. We have to protect our medical providers. So if we go on to the next slide, this is from the Hawaii State Center of Nursing from Laura Reichert and her development people. If we go to the next slide, we can see here that in the proportion of the state for nurse practitioners who have had full practice authority since 2025, we are significantly short. The most abundant people that you can see are over here in Honolulu. There's some near Hilo, and then a little bit over on Kauai. But if you go into the next slide, you can see here that from May of 2023 to May of 2037, every county except for Honolulu County is expected to lose more than 50% of nurse practitioners. And if you go to the next slide, every county except for Honolulu County is looking at losing more than 85 to 100% of psychiatric mental health nurse practitioners. Our Hawaii medical workforce is not staying here. They're not staying because of cost of living, because we as medical providers do not make enough money to stay here. Do you know that most nurse practitioners that you see in practice are working 2 or more jobs just in order to live here? That's insane. And doctors aren't leaving. Yeah, last year, Hawaii lost the only colorectal cancer surgeon that took Quest. We lost the only one. They moved to Ohio. We don't have anyone doing colorectal cancer who's taking Quest. Let's go on to the next slide. So here, when we look again at the national average of transgender folks, if you go on to the next slide, by July 2025, 25 states had banned gender-affirming medical care. 6 states imposed felony charges on providers who are providing gender-affirming care. If you go to the next slide, by July 2025, the U.S. Department of Justice announced that it sent more than 20 subpoenas to doctors and clinics involved in providing transgender services. And if you go to the next slide, by February 2026, 3 healthcare agencies in Hawaii who provided gender-affirming care have closed or stopped providing services, and more than 3 to 5 medical providers have ceased operations or left the state. And I know that 3 to 5 medical providers who provide gender-affirming care, that doesn't seem like a lot of people, but I can count on less than 2 hands how many of us providers in the entire state are doing this work. So when you lose 3 of us, I now am down to 1 hand. We have to provide protections. If we can go on to the next slide. People think, oh, you're just throwing hormones out at people. Oh, you're just doing surgeries. That's not true. I have to abide by evidence-based practice. This evidence-based practice is presented here by the World Professional Association of Transgender Health. We even have a US section. The Standards of Care for the Health of Transgender and Gender Diverse People, Standards of Care version 8 came out in September of 2022. I have to abide by those regulations. I have to abide by those rules, otherwise I'm at fault. You can sue me for not being in practice. I'm not just going out here willy-nilly saying, oh, I'm gonna give you this. No, we have to provide gender-affirming care within its own practice. And I have to tell you something, just a little caveat. Gender-affirming care is not just transgender medicine. If you are a cisgendered woman and you go and get breast implants, you go and get your hair done, you need estrogen because you're in menopause, that's gender-affirming care. If you're a cisgendered male who is having low libido, erectile dysfunction, and you need testosterone therapy, that's gender-affirming care. We have to be protective of everyone in this state. I live by the American Psychiatric Association, I live by the American Medical Association, I live by the American Association of Clinical Endocrinology. You can go on to the next slide, Alan. When we look at our transgender, non-gender confirming folks, 19% don't want to go to the doctor. 28% have had bad experiences. 50% of people have been harassed or sexually abused by medical staff. If you go on to the next slide, you know, I recently saw a video where a congressman stood up in front of the legislature 3 days ago and quoted this very article that is up and quoted the Bible against it. You know, maybe I'm different. I grew up Catholic. I grew up in my church where everybody was accepted. And I don't think that the Bible should be used to weaponize against others in this country or anywhere in the world. So I was reminded recently in a book that I was just reading of this passage from John 15:13 that says, "Greater love has no one than this, than someone lay down his life for his friends." And what that means is that you put others before you put yourself. And I hope that the legislators in this building do that every single day. I hope that they put their constituents' lives and thoughts and feelings before their very own when they're considering passing this bill. So if you go on to the next slide, you know, I stand here. No, that's not right. I want everyone to stand up with me. Everyone stand up. I stand here with you, dedicating my life to making others better, to making positive change. And so I want you to stand with me. And if you're here today to make positive change, say it. Say, I am here to make positive change. I can't hear you. Louder. We can go to the next slide. And I thank you for your time.
I don't want that thing. I'm already tall. Thank you, Dr. Rick. That's kind of a hard act to follow. My name is Madeline Setsupasara. As you heard earlier, I'm Samoan. I come from the West Side, and I've been living as a trans woman a lot longer than the other person. So I stand before you as this proud trans woman. And Dr. Rick, your presentation got me emotional. So I'm just going to start off with those slides. The 9%, the 12%, the 50%, that's me. That's what I experienced. I can remember going to the doctor's office, not feeling good and wanting to get serviced. I asked him kindly, can you, because my name wasn't changed at the time, and I asked him, could you please call me by this name? And I remember that nurse looking straight at me and telling me, I'm going to call you what it says on your ID. And if you don't like it, you can just go somewhere else. And that's exactly what I did. I left there crying, because that was the first time I've ever experienced someone hating me for being trans. That's how I took it, because they didn't honor me. And so I didn't go. I never went to a hospital. I hated going to the clinic. When I had to, I cringed, because I was afraid that they're going to clock my teeth, or they're going to just be mean or just vicious, as we call them, nails. So I never went. So, my gosh, those slides just are so powerful. I remember, a nurse when I'm in there asking me, "Oh, your breasts are so big." Da 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 da. It was uncomfortable conversations. At the time, I didn't know. I was just answering their questions, but I didn't know better. I didn't know better. I was young and stupid at the time, I felt. But let me just go back to my story. That was really powerful, so thank you for sharing that. When I started transitioning, my sister, who is also trans, I come from a family of 6 siblings. Originally 4 boys and 2 girls, but now there's 1 cis brother, 1 cis sister, 1 butchie, 2 trans pre-op, and me, the sex change. That's how I like to tell people, and they're like, "What?" I said, "Yeah." So that's my my fruitful family, and I love my family. I thank my parents for when I did come out that they accepted me, because it wasn't the same for a lot of my trans sisters and brothers when they came out. A lot of them were thrown out of their homes. And what I've come to learn in this field of work, doing this work for since '95, was a lot of them parents were afraid, so they tried to control their kids by, don't do that, And because they couldn't do that, it was easier for just kick them out so they didn't have to see them. That's what I pretty much saw, because a lot of them have relationships now with their family. By the time their parents are afraid, just like mine. When my trans sister came out, my parents kicked her out. But when I came out, it was a different story. It's because they knew I was Maho. They totally were blindsided by when she came out. Um, so she was the one that when I decided to become out, she took me to see Dr. Rodwell. And this is how it was for all the trans girls from, I would say from the 70s all the way to 2009, 2010 till he passed. And he was the only doctor that actually would provide services for trans women. And it was just hormones. It was just getting our hormone shots, and that was pretty much it. And so anybody that came to the island, any trans girls, they heard about this doctor, they would go to him because he would provide hormone shots. But that's it. You didn't get no blood work done. You didn't get any checking how your livers, your kidneys, any of those things. You know, your diabetes. It was more like if you coughed, he'll be like, get a piece of candy right there and suck on it, and that was it. You know, and we went on with our day. When he passed in 2009, 2010. Our trans community felt it. We were like in such a panic mode, like what are we going to do? You know, who's going to provide these services? And it was hard for us for a while. You know, when we tried to get services, it was like ridiculous prices for the hormone shots that would get from Dr. Rodwell, which was like $15. It was now like freaking $150 to $200 for one shot. And so, you know, thank God we had a bunch of leaders. We had a bunch of folks that allies that really wanted to help us figure out gender-affirming care. And we didn't know what gender-affirming care for trans folks was at the time. This is new to us. We're like, what? Gender-affirming care for trans, what is that? You know, it was new for us. This is a whole new ball game. And, you know, thank God, you know, they taught us and said, yes, you deserve your own gender-affirming care. We can fight for this and all of this. And was like, really? I was like, really? Kathy Kapoor, who was my supervisor at the time, she was the one said, yes, we need to fight for a gender-affirming care. And we did. And I have to tell you how amazing and how life-saving it was for our community, especially for our Kapuna folks. They never thought they could ever get this. They never thought they would ever have the opportunity. You know, a lot of them died depressed because they didn't die in the body that they were comfortable in. They just had to bear with it and deal, you know. That's how it was for trans folk. Now they have this opportunity where they can get surgeries that they never thought they could get done because they couldn't afford it. Trans folks was too busy trying to survive because no one was giving us jobs. We had to turn to prostitution. We had to do stuff to survive. You know, no one was giving us that opportunity, so we did what we had to do to survive, you know, and that's how it was. So having gender-affirming care, you know, for me was like, I never thought this would ever happen. And I see the amazing work that it's doing for our young folks, for our Kapuna folks, and those that never ever thought they would be able to do this or get this done. Suicidal rates have gone down. I don't know if you noticed that, but it has gone down because of gender-affirming care for trans folks. I see that in this field. I've talked to, you know, I've had conversation with clients that before gender-affirming care, how they don't know if they can go on if they don't get this surgery done. They don't know if they can go on another day because they're not comfortable in their body. By having gender-affirming care for trans folks, you're giving us an opportunity to live our truth and be comfortable in our own body. That's what I saw when this all happened, and why it's so important that we continue to fight, and why I thank everyone in this room and everyone that's watching and everyone that wants to learn or wants to be our allies, that we thank you. You guys are part of the reason that we're here, that we're able to continue this fight. And I really hope our legislatures hear us, because this is our life. Those slides that Dr. Rick showed, that was us. I know Kapuna folks who had to pay out of their pockets to go see a doctor. And it wasn't cheap for them. That's why a lot of them die at younger age. when they could be dying in their 90s, you know, their 80s and 90s, but no, they're dying in their 50s and 60s because of health disparities, because they couldn't get the care back then, because of how society was. It's not like that no more. It's not, and Hawaii has the opportunity to shield this bill because we need it. We need it for our community. Our community is thriving now. We are just 1%, but we are thriving and we're living. No, you know, depression is not as bad. Suicidal rates is not as bad. But you guys are gonna fuck it up if you guys don't shield this bill. Just my statement. I'm just gonna say it again. I never thought we'd be able to do this. And it's so wonderful. And I thank my Kapuna folks who have fought in the past. Because I don't know if you know, back then we had they had to wear buttons that said they were a boy. And they fought, so they've been fighting. And they deserve opportunities, just like our young folks deserve opportunities, just like the next trans person or non-binary person that comes out deserves every opportunity. So I'm just gonna ask our legislature that's probably watching, because I don't see you in this room, but I'm begging you, I'm pleading with you to please shield our bill in the state of Hawaii. We need it. Show it. Show us what y'all made of. That's why we love Hawaii. Thank you.
Thank you so much, Maddie. And thank you as well, Dr. Rick. Before I introduce our next speaker, which will be Mandy from the ACLU, just wanted to highlight a couple of pieces that both of them said about the bill. Again, we're talking about HB 1875 and its companion. One of the protections is ensuring that malpractice coverage cannot be denied just because a provider is providing gender-affirming care. So there's been some myths that this bill would protect providers from malpractice. That's not true. As you heard from Dr. Rick Ramirez, any provider will be held to the standard if they operate outside of evidence-based medicine. What the bill will do will make sure that providers like Dr. Rick can get the important protections that they need in order to practice. We also really heard from Maddie about the importance of having access to medical care like the rest of us in this room, and that this bill would not mandate anything but put the choice and the discussion of healthcare where it should be, which is between people and their medical providers and their families. And that's what this bill would do. So at this point, we are going to hear from one of our policy experts in the room, which is Mandy Fernandez with the American Civil Liberties Union. She's going to talk a bit more about this from a policy perspective. And then after her, we are going to bring up Abby Alana Simmons, who again is the Stonewall Caucus Chair of the Democratic Party. But please help me in welcoming Mandy Fernandez from the ACLU.
Good morning, everyone. Good morning. Ah! My emotional support coffee is going to have to go on the ground. Oh, the big stool? I know I am. Not so blessed with height. Hi. All right, good morning. Like Heather said, my name is Mandy Fernandez. My pronouns are she, her. I am the policy director with the American Civil Liberties Union of Hawaii. So we're a nonpartisan, nonprofit organization. We've been around in Hawaii for over 60 years. We seek to defend the rights that are guaranteed to us by the state and federal constitutions. I want to take this opportunity to zoom out for a little bit. This is about a lot more than healthcare. It's a larger attack on our fundamental principles of bodily autonomy. And what we're experiencing right now in the United States, and what a lot of countries are experiencing right now, and what we've also experienced throughout US history, is a democratic backslide into authoritarianism. And in order to take hold, authoritarian regimes must polarize people. It's something that's part of the playbook. It's something they have to do in order to take hold and maintain that power. Convince people that they're the change that's what's needed. They have to define an enemy. And they pick, part of the authoritarian playbook is that they pick a minority that doesn't have the numbers to defeat it just on its own, right? So they pick, and we've seen examples of this, right? We've seen examples throughout history of different authoritarian regimes going after a minority population and deeming them the enemy and defining the enemy in that way so people don't turn against them. And this is what's happening with trans folks in the United States right now. We often think of us in terms, we often think of this in terms of Trump, and I'm going to reference the administration as sort of the primary doer of these attacks on trans lives right now, but we know it's so much bigger than Donald Trump. If Donald Trump died tomorrow, it wouldn't change right away. He's the figurehead. This has been in the works for a while, right? And this moment has been planned for a long time, and it's aligned also with global efforts and what we've seen in other countries across, for example, Eastern Europe. And what's holding up all of the pillars of support that are holding up this current administration would also hold up another figurehead if necessary. And I say that not to be a downer. I feel like I'm such a downer up here right now. We had this very inspiring talk from Maddie, and now I'm up here to just kill the mood. And I'm sorry about that. It's sort of it's an occupational hazard of mine. But one of the things, going back to how authoritarian regimes absolutely must polarize the electorate, they have to drive a wedge within communities. They have to drive a wedge within existing powerful voting blocks. And this is a manufactured controversy. They really plan it, they do polling, they do focus groups, and they figure out which issues are going to be the wedge issues that will work. We're demonizing immigrants, we're demonizing trans folks, and we've seen the demonization of trans folks even within queer communities. What conservatives have done a very good job of is convincing cisgender women, queer or straight, that trans women are somehow a threat to us in sports, in life. And we know that that's simply ridiculous. But a lot of cisgender women, and I'm really ashamed to say a lot of queer cisgender women have bought into this narrative that somehow trans women are here to take opportunities away from us. And when you buy into these narratives, you're just being used for this larger agenda, right? Because factually, this has no basis in reality. It's absolutely ridiculous. The reason why your daughter doesn't make JV soccer is not because of the one trans girl on her team, it's because she kind of sucks at soccer. You know, like, she's not the next Mia Hamm, you guys. Like, she's bad at soccer. But another thing this administration is doing, and what we've heard about today, and the topic of this panel, is attacking access to gender-affirming care. And this has been done through executive orders, through issuing broad subpoenas to clinics to try to create a chilling effect, lots of threatening for funding. We had the Kennedy Declaration, which declared that gender-affirming care was not the standard of care, demonizing gender-affirming care for youth in a way that was not based in medical evidence. And when we take a step back, we realize why this is not based in reality is that they are only applying it when that care is for trans people. The same care is given under standard of care to cisgender people all the time. Often not life-saving, often not as life-saving, and yet it's still not under attack. And the arbitrariness is what really tips the hand that it is part of this larger authoritarian agenda, right? Because it doesn't have to be based in evidence, it doesn't have to be based in logic or reason, because its utility is not furthering any sort of medical science or actual social good. Its utility is division. The cruelty is the point. And this goes back to why it's an attack on bodily autonomy more broadly, and how it serves the onset or the backsliding into authoritarianism. Is it dispossesses a certain group of people of their own right to say, this is what happens to my body. And when we allow that for a certain group of people, we will allow that for more and more people. We've seen extreme, I don't use this term lightly, because it's kind of an ick of mine when people misuse it, but we've seen blatant gaslighting from this administration, telling us that we don't see with our eyes what we're seeing, telling us that we can't believe our own critical thinking skills or our own judgment. And what the administration is doing, but not just this administration, but this larger movement and this larger goal, part of it is to rewire people's thinking so that they don't trust themselves and they only trust the autocrat in charge. It's a critical tenet. It's a critical tenet of the onset of authoritarianism. So when we fight for trans access to healthcare, it's so much larger than that. And it's about this larger reclaiming of what it means to have bodily autonomy under the Constitution. It's about making sure that our laws apply equally and that medical data are used to drive policy decisions around access to healthcare. This care is legal, safe, and based in evidence. And the SHIELD law that we're talking about today makes sure that access is not denied out of fear of retribution, not just from the federal government, but what the SHIELD law does is it protects the care that we have designated as safe and legal in our state, under our state constitution, under our laws, for our residents, for our communities, and make sure that providers of that care are not punished because Texas has decided that they want to demonize trans people. It's really critical that we pass this legislation. It's not just to protect this one type of care for one community. It's to defend against this larger attack on bodily autonomy. And so I'm hoping that our legislators, our decision makers can see it that way. That if they come, it's that they come for one, they come for all eventually. And that's not why we should support it, but it is part of it. And standing up to authoritarianism means defending our communities that they're most vulnerable to their attacks from the get-go. So that's all I have to say right now. Thank you.
All right, thank you so much, Mandy, and thank you so much for contextualizing this in the larger context. And again, why this is so important that Hawaii passed this law to protect, as you said, what's already a right under our state constitution. I can't think of a better individual to take this home for us. Abby Alana Simmons is the chair of the Stonewall Caucus of the Hawaii Democratic Party, but more than that, she has been galvanizing and organizing all of us to come together, speak our truths, and make this change. And so please join me in welcoming Abby to the stage to bring us home on this important topic for today.
everybody. I feel extra tall today. I think now I'm about 6'2". So thank you everybody for coming today to show your support, to show your interest, to be willing to listen, to be here with an open heart, open mind. That really means a lot. I'm chair of Stonewall Caucus. My pronouns are she, her, but I'm also here as a woman of trans experience. I'm here as an individual advocate as well. And I wanted to talk to you today about the things that we as a community have been experiencing over the last year. Let's see if I can. Okay, better. So on day one, the current federal administration declared that people like Maddie, people like me, we don't exist. But we're here, we do exist, so. They used hateful language in their executive orders, scientifically untrue language, medically untrue information, to issue decrees about us and who we are. As you know, trans people in one form or another have been around since the beginning of time. We've existed, we've contributed to society, we've played our part. So what's changed? Well, in the last 10 years or so, with social media in particular, people could see how joyful it is to be trans. People could see that you can be successful and trans. People could see that you could serve honorably in the military and be trans, that you could be a legislator, that you could be anything that you wanted to be. And yes, it's not going to be easy, but you could do it. Others are doing it, others are leading the way. And the backlash, it almost immediately ensued. So what we're experiencing today as a community, we've experienced in the past, but we're experiencing it so much more because people have seen how we can be joyful and successful and contribute to our community, that we don't have to be pushed into the margins, into the shadows, that we can be happy and just a functioning part of society and contribute so much, that we can exist outside of the stereotypes. So they've decided, well, you are now a threat in sports, but not a threat in the military. They've decided we can't use bathrooms in certain parts of the country without committing a felony. They've decided to come after the parents and providers who are just taking care of the youth, who are providing gender-affirming care. They are spreading misinformation, hatred, lies, dividing us. And I'm sorry if this sounds like terrible. It is, it's terrible. But we're not powerless, and we can do something about it. And this is why we're here today. We're here today to say we need to protect our providers and our community by passing the SHIELD law, HB 1875. So here's kind of a challenge. What's gender-affirming care? Dr. Rick did a really good job talking about some of that information. But when you're talking with legislators or folks who are not necessarily in the know about gender-affirming care, there's a few things to share. First of all, you don't have to be an expert in knowing what gender-affirming care is, just like you don't need to be an expert in how to treat diabetes or any other treatment that's out there, medical treatment. You don't have to go to medical school to protect a patient's right to make their own decisions for their own body. You just have to be a decent person. You just have to be a decent human being. When I decided to publicly transition, it took years before, years of questioning myself, years of going through all of these questions about, you know, is this the right thing to do? Is it safe? Like, am I going to lose my job? Am I going to lose my family? Am I going to lose my friends? Am I going to lose the safety that I built for myself over the years? There was so much fear and so little time spent thinking about what could be, how I could benefit from it, how my life would improve. I was just in this cycle of fear. And thanks to gender-affirming care, finding the right therapist helped me find the answers to my own questions, helped me find a way to solve these questions for myself. And that's gender-affirming care. With the first time somebody addressed me by my pronouns, that was gender-affirming care. And every time after, that's gender-affirming care. So gender-affirming care comes in so many different forms and ways, and it starts with respecting and the common courtesy of addressing somebody by their pronouns and by their name. Gender-affirming care also for youth looks like and can look like therapy, like through a therapist, or it could also look like puberty blockers. What are puberty blockers? Well, I'm not Dr. Rick, and I don't want to go into too many details, but puberty blockers block puberty. And why is that a great idea for folks specifically who should be on puberty blockers based on the decision made by their physician and the patient's family? Well, it delays puberty. It blocks it while they're taking this medicine, and it's fully reversible. So when they stop taking puberty blockers, puberty ensues. So it's a fully reversible thing, and it basically stops the clock, pauses the clock, and allows the patient and the patient's family to determine what they want to do. And so why is that beneficial? Well, we often talk about surgeries, right? I mean, we talked about gender-affirming care and surgeries. A lot of those things wouldn't be necessary for adults had they been on puberty blockers before and had the chance to decide when, like later, in terms of what they want to do, right? It's buying people time. Puberty blockers are also taken by cisgender people for various reasons. I can think of an example. I think some gymnasts take puberty blockers to delay the onset of their puberty so they can compete in Olympics. So I don't want to get into too many details, but what I want to share with you is that gender-affirming care comes in many different forms. And it's absolutely life-saving. And it's absolutely medically necessary when the medical professionals say that this is necessary care. And the patient makes that decision, and the patient's family in some cases. It changed the life for me in a better way. You know, all that energy that I spent trying to figure out, worrying about what ifs and how, and not spending the time about what could be where I could just be myself and I could be productive and I could put my energy into doing positive things and being engaged in my community. You know, all that happened because of gender-affirming care. I was able to do the things that I want to do with my life and become a contributing member, a better contributing member to society, and be a better spouse, and be, you know, mentally available to focus on life, like everybody else is focusing on their lives. So I ask for your support to come out and please come out and testify, whether you're doing it written or whether you're doing it spoken or written and spoken, which is preferred, to support HB 1875. And HB 1875 will protect not just the providers, but it will protect also families, and you'll be protecting people's right to choose what they want to do with their own bodies. You don't have to be an expert, again, about any medical procedure. You don't have to go to medical school to respect the medical profession. I trust a doctor who's gone to medical school. I don't trust Facebook. I don't trust, I don't get my medical information from social media. I'm sorry. No, I'm not sorry, but I don't recommend you do it. So in closing, please support HB 1875 because it really will make a difference. You will be saving people's lives. You will have not met the people, but you know that you're actually doing something to protect folks. And when these providers don't get protected, they're going to leave, and we already have this problem with providers leaving, and they're doing so much more than gender-affirming care. So they provide all kinds of care, and when they say it's not safe to practice medicine in the state of Hawaii because we are not protected from these out-of-state, hostile actions by hostile attorney generals, like from Texas, for example. We're not protected, so we're going to leave. That's going to hurt everybody. It's not just going to hurt the trans population. So there's so many reasons to support HB 1875, and I invite you to come and visit us upstairs on the 4th floor at our table at Stonewall. We have a handout. It's a one-pager. It's going to summarize the bill. It's going to summarize the key points of information, and I think it's a really helpful tool to have when you're providing testimony. And I look forward to meeting you all in person. Mahalo nui loa. Thank you.
Okay, as we get our chairs together, I'm going to ask Alan, the one fabulous right here, to put his hand up if anybody's got a card that they have a question on. Feel free, maybe pass out some cards that are up at the top, as well as gather any cards. We have about 20 minutes to talk story with these great folks here. Okay, perfect. Okay, so first question, this is for any of you that want to share. I'll just pass. What have we not talked about with gender-affirming care that you want to highlight for this group? So what have we not talked about that you want to highlight around gender-affirming care? And if we've already talked about it and just want to emphasize, you can do that too. We'll start with Dr. Rick.
That's a great question. I think ultimately what we haven't really honed on in too much, but some points have been made, is that when we look at HB 1875 or the SHIELD law, what we're really protecting here is the person's autonomy to make their own medical decisions. Gender-affirming care is already legal in this state. We are already performing gender-affirming care. And so when we provide this, this allows people to continue to do that, to seek out these healthcare services without repercussion, without persecution, and without the risk of their medical providers also being persecuted and or being arrested. So I think it's important to recognize that a person's wish to seek out medical care for whatever reason should never come into question, no matter who you are. And this bill recognizes this, whether it's medical care, mental health care, personal care, whatever it is, we have the right in this country in order to be able to do that.
The question was, you know, it's the surgeries. You know, it's people are so stuck on that trans folks just want to get surgeries, and that's not the case. We want our bodies, and you know, we want to match our appearance and what we feel comfortable in, and it's to save lives. And you know, me and Shalani had this discussion last week, and we're like, you know, when it comes to like the breast part, it's like you can tell who spent money on their breasts and who got the gender affirming care breast, because you know, they go according to your breast size, as to where if you're not comfortable with it, sweetie, you got to go pay big bucks and go get them bigger if you want it bigger. Same thing for women, you know. It's people like to like, oh my gosh, I just want all this surgery. That's not the case. We want it to match our appearance, and if you want it to enhance it a little bit more, you got to go spend the money. You know, it's not all this glam. Everyone thinks it's all glam. It's not. And this is our life, you know. We deserve gender affirming care like anyone else, you know. And and then this bill, what I want to highlight is the fact that we have parents now, you know, that we're protecting parents. We didn't have that before. Parents, like I told you earlier, parents were kicking out their kids because they didn't understand or because they weren't listening. Now we have a generation of parents where they want to be there for their kids, and we need to protect them. You know, I'm just loving the fact that we have parents that are wanting to support their children and support their family, and it's a beautiful thing. And so to all the parents that are doing their part and providing care for their children or making sure that they have the resources, thank you, because you're letting your child live and they're going to thrive. I'm telling you that they are going to thrive. As long as you support them and let them be who they are, I'm telling you, your child is going to thrive like no other. Trust.
Thanks, Maddie. I also want to share that it's a little bit about safety as well, right? Um, because the society that we live in everything is very gendered, right? So if I'm traveling, which I try not to travel into areas that are not safe, but if I'm traveling into those areas, having had gender affirming care, having had, you know, the care that I need to appear the way I appear gives me a sense of safety. I feel safer going out in public, you know. So yes, it's actually also not just affirming who you are on the outside to match your inside, but it's also giving you a level of protection that you wouldn't have otherwise.
To add on to that, one of the things I was thinking about is how this is a dual track from this larger agenda, right? To at once create more hostility, more animus towards trans people, and then to make it harder for them to navigate society without being confronted by violence or prejudice. So like Abby was saying, denying access to care to appear a certain way exposes trans people to more violence while also cultivating and increasing the sense of animus towards trans people. And I think that part of that is that this larger effort wants trans people to be more like clockable. They want people to be able to tell, because a lot of people you ask and they'll be like, well, I've never met a trans person. You're like, oh, bullshit, you have. They want to expose trans people so that they can point to someone being the enemy, right? They want this greater visibility, and denying care in a way does that. And they also, sowing violence is a strategy, is a tactic from authoritarian regimes. And this does that, and to sow violence among the people so the violence doesn't go towards the administration. And that's what that accomplishes.
Thank you. And I think for me, I want to say that this is not a symbolic gesture, this bill. This bill will literally protect what's already in our Constitution and save lives. So it's not something that we're just talking about, but it really is something that has shown in evidence to help people be able to not just be who they are, but hopefully face less discrimination. So we have an audience question, thank you. And if you have any others, we have Alan warming himself up around the room, getting those. So this one says, I hear people say, quote, I'm okay with gender affirming care, but I don't believe kids should start gender affirming care before 18, unquote. How do you respond to that? So I'd love to hear from a couple of you of your recommendations on how you would respond to that. Yeah, we'll start with Abby.
I think everybody is free to have their opinion, but it should really be up to the decision of the patient, the family, and the doctor. So I don't get to make decisions for your kids. So nobody else should.
What a really great question. Thanks to whoever asked this. I think this is a common theme when we talk about gender affirming care. We always want to hear more about youth and how youth are impacted. I do want to say that in medical literature and in mental health literature, what's really interesting is that people start having these discussions even starting at the age of 9. People have these discussions with their parents, they have their discussions with their therapists. What I want to really impart upon you is that when we enter gender affirming care with youth, it's not something that we just jump into. It's a conversation. We start out, okay, let's talk about this. What does that mean to you? Do you actually understand what you are asking for? Do you know where this is going to go? We have these conversations and then we discuss, okay, we can't even start gender affirming care until you reach puberty. We can't even start that. So that might be years in the future. And even then, again, it's conversations with patients and their families. Do we start this treatment? Is this treatment right for you? We make our therapies and our decisions based off of each person. Every person is going to be different. So I don't, if a young person came to me and be like, put me on puberty blockers now, I'm gonna like, oh, wait a minute, no, let's talk about this. Let's make sure that it's the right decision. We don't enter any conversation with any person, no matter what age, seeking gender affirming care, just willy-nilly. We talk about it, we have conversations, and we look towards our medical literature and what our literature states about what is the most appropriate decision, and then we enter into a shared decision-making process with the patient, the parent, and all people in their lives that are important to them, including their healthcare provider.
Thank you so much. Again, the 1875, HB 1875, doesn't mandate anything other than the protection, and again, allowing these decisions to be held between people and their medical providers. We had another question from the audience. So do you recommend talking to people that in the legislature that we know are opposing this bill? Have you done so, and how did it go? I'm going to start with our policy folks over here. Mandy, do you want to, any thoughts on this one?
I think identifying the bubbles or the persuadables is really important in legislative advocacy. I personally don't, if I feel like engaging with the anti-voices is only going to cause them to stir up their base more, then I don't. I think about like, what is my goal in this conversation? I don't know that I haven't been lobbying. When I know somebody's a no, it's usually for a good reason. And I don't engage in that, right? Because I don't like to waste my time. And I also don't want to give someone an opportunity to rally up opposition. So I'll hand it to somebody else if you've been having these conversations, but most of the conversations I've been having have actually gone very well. I think that like part of being human is that we do all want to get it right, and we do want to do the right thing. and part of an advocate's job is to give others the opportunity, even if they're not there, meeting them where they're at, and give them an opportunity to come forward with you.
So I'm kind of going to use an example. If we have a two-party system, unfortunately, and if one party invented the cure to cancer, the other party would vote against it for the most part, right? I mean, that's what we see on a federal level. In terms of advocacy, our resources are really finite. So we have to be very mindful on how we expend our energy. And so in that sense, I like to direct the resources that I have to the outcomes that are most likely to benefit passing this bill. So that being said, is I won't focus necessarily on having conversations with legislators who I know are supportive. And I don't have those conversations with legislators who I know who are not supportive. I try to focus on the folks who I don't really know, and I try to kind of get a feel for what their questions are and which way they're leaning, and try to educate where they're asking to be educated on.
Did you want to say anything, Maddie? Okay. Maddie said, just don't invite her, which I actually think is very relevant. We also know what activates us and what manages. And so, as Mandy said, they're trying to divide us, and they're trying to get us to have that reaction, so that reaction is what's on social media instead of our messaging. Yeah. Thank you for sharing. Appreciate that. I think Mandy had a thought.
Yeah. No, I mean, I think we're I think we're talking past each other a little bit, right? Because I don't think anybody up here was saying like don't engage with people who disagree with you. Yeah, but I think that when it comes to advocating for a bill, when we're counting the whips, like we're like, okay, do I have how many no votes do I have? Like I think we on either end of the spectrum, we know that our resources are going to be best spent like in the persuadable middle. But I do think on a broader scale, what is actually necessary, and the only thing that saves democracies historically is these broad coalitions, a broad, diverse coalition, and that does mean engaging with people who disagree with you, and that is what global democracy and peace scholars have said is that it's actually about like repolarizing. So getting together with people who don't agree with you on everything. The left is really good at kicking people out when they're not 100% perfect. We're really good at that. It's also contributed to this moment. And it's like I won't tell somebody else like you need to give someone the benefit of the doubt, but if we all want to meet this larger goal of saving democracy, or turning around democracy, or reimagining a better future here, it is going to take engaging with people who disagree with us on a lot of things and finding that things are common. Like there have to be some values that we have in common, right? It's very unlikely that you're ever going to talk to a person that has nothing in common with you. So I do agree that on this larger scale, I think we were thinking, because we're in this Capitol building, because we're all just like tunnel vision, we've got to pass this. We're talking about like specifically advocating on a bill, and no, I don't think that it's necessarily worth your time to go meet with a particular rep who you know has been introducing anti-trans stuff. I don't know that you're going to get anything done in that meeting, but on a larger scale, yes, 100%. The evidence shows that we need diverse, broad coalitions in order to save democracy, in order to defeat this larger effort.
Yep, thank you. And I do really appreciate the point. I'm a cisgendered woman, and I think all of us that are cisgendered need to also speak out, not only, but use the privilege that we have to speak out about this. It's also safer for us, some of us, to speak out about this than others as far as the amount of harassment. So we had a couple more questions if we can quickly get to them. One of them, actually, Maddie, you already brought out. How can we educate people that, quote, sex change operations, unquote, is not the same as, quote, gender-affirming care, unquote? So how do we help educate folks that gender-affirming care is more than surgeries and changes? It could be to anybody, but I don't know, Dr. Rick, if you want to say a little bit about that. But what is that short answer to help people expand their understanding of gender-affirming care? Because many people boil it down to surgery.
Oh, hello, microphone. Yes, that's a great question. I'm sorry that the microphone cable is so wonky. I think yes, when people sometimes hear gender-affirming care, they immediately go to that. I have been doing gender-affirming care for years. I see many of my medical practitioners who are in the field with me in the audience today, and I think that we would all agree that there are levels of transitioning. There are different types of transitioning. There's social, there's hormonal, there is surgery, but it's not just all in one bucket. You can be trans and do absolutely none of the above. You can be trans and do everything of the above. You can be trans and do column A, but not column B, and some of column C. It's not one picture fits all. It's not cookie cutter. It is individualized for each person. And so the question is gender-affirming care more than just surgeries? Yeah, absolutely. There's a whole broad spectrum from A to Z that it includes. And we as healthcare providers, we as social advocates, we as mental health care providers, we as advocacy experts all recognize that there are different avenues that anyone can go through to transition, and we are here to help.
Yeah, and because it's advanced now, the conversations are totally different. And as even for trans women and those that think they're supposed to be trans, like I told you earlier, a bunch of us came out thinking because we're mahu, we're supposed to be girl. you know, and that's what happened to a few of our friends. They thought that's what they wanted, and they realized that's not what they wanted. It was just Mahu. And so, because they didn't have, like I told you, we only had Dr. Rodwell, where it was just you get the shot. But now, you know, we're having conversations with our own sisters, and they're telling us, this is not what I want to be. And, you know, and so we've never had that conversation. Oh, well, I thought this is what you wanted to be. And so now, because you have that conversation with your doctor, you're able to talk about it. What do you want to be when it comes to Mahu? What kind of Mahu you? You want to be a Mahu transgender? You want, what kind of Mahu? And having those discussions, you know, and making the right choice for themselves. You know, not everybody wants their sex reassignment, because some of them still enjoys their tools, you know, like I'm sorry, Dr. Rick said. It's about, you know, everyone is different. Everyone's gender affirming care is different. It's what they want out of it, you know, and some girls don't want the surgery, and it's okay, you know.
And I really appreciate the point that most people access some kind of gender affirming care sometime in their lifetime, whether it is looking at things around wanting to better express my gender identity, or whether it's getting older and our hormones changing. We have one last question, and I know we're at time, but I'm going to ask this to be quick. Like you all mentioned, this issue is intersectional with so many others, you know, income, workforce, racial, indigenous justice, etc. What other bills or issues are you paying attention to or supporting? And I love that we're ending on this. So of course, since I have the microphone, I do need to mention HB 1549, which would repeal the drug paraphernalia law. We feel that's incredibly important because many people are criminalized based on a behavioral health issue, and that includes regardless of gender. So that's the one I'm going to plug. But let me just give the mic down the line, and any bills, whether you know the number or just the name, that you want to give a shout out.
Yeah, this is the bill that I was looking on, worked with Adrian Tam on. Shanda probably knows the bill number. I can't remember it right off the top of my head, but it is looking for, okay, so in the state of Hawaii, it is legal for you to go to the Vital Records Department at the Department of Health and change your name and change your gender. It's legal to do that, okay? However, in order to change your gender, you have to have a notary public person present, and you have to have in person a physician or a physician's assistant. Now, if you have only been seen by me, a nurse practitioner, I don't have the ability to sign that document. I'm not allowed according to the law, because the words nurse practitioner are not in that law. What kind of crap is that? I've had full practice authority since 1995. So we have introduced a bill, thanks to Adrian Tam, in order to correct that language. And in fact, through Laura Reichart and the entire Hawaii State Center of Nursing, we're looking at changing languages in all healthcare bills that just say health care provider and don't specify doctor, nurse practitioner, or physician assistant.
That bill. And then I believe we have a smoking cessation one, but Michael's not here, so.
So I will say Stonewall is tracking probably somewhere around 40 plus bills right now that we're looking to testify and support, and a few to oppose as well. The things that we track is intersectional. It aligns with unmasking of agents, police agents, immigration justice, immigration rights, and of course there's also Senator Chris Lee's bill about protecting students from harassment and violence based on gender identity and sexual orientation. So there's a bunch of bills that we are tracking, and you folks are welcome to chat with me afterwards on the fourth floor, and I can fill you in on any questions you have.
Yes, I would also highlight our immigration package. The ACLU is on the steering committee of the Campaign for Immigrant Justice, so there are a bunch of bills in there. Detention facilities are not safe places for queer trans people at all. Full stop. And to think of a response earlier, if somebody is like, oh, I don't support this for youth, you're like, okay, do you support the thousands of children that are right now in immigration detention that have been reporting that their food has worms in it, that are being held in privately owned facilities, that are sleeping on the floor. No, like if you care about children, you care about all children. And I think that reducing our reliance on these punitive systems, on racist systems and transphobic systems like our carceral system and our immigration detention system, right now that's really critical, because anywhere where there's marginalization of peoples, trans people are going to have it worse, right? And so, and again, detention facilities for immigration purposes are not safe places. And a lot of people who have immigrated and are trans have done so out of fear for their lives. And to initiate deportation proceedings for these folks, to send them back to a place where they might not be safe in their communities, is sometimes tantamount to a death sentence. It's critical that we get this immigration package forward, and I would urge you to call, even if you don't know the bill numbers, say like, we need that immigrant justice package, and they'll know what you're talking about.
Okay, thank you for staying a few moments late to hear this amazing wisdom. Let's give it up for our panel today. Thank you all for taking time out of your busy day. You may need to get some feeling back in your fingers, so thank you so much for being here. On your way out, if you want to pick up some of the flyers about 1875 to spread the news, and then as you heard, starting at 11 o'clock, there's going to be tabling upstairs on the 4th floor, and then back down here at, is it 2 or 3 o'clock? 2 o'clock for another panel, actually, I believe that Mandy is going to be supporting as well. Thank you so much for being here today, and please have a great rest of your day.